Look, I do perform a significant number of interstate patients, mainly for the fat grafting. People travel, but sometimes they travel for other reasons. They just have to be mindful of the challenges of follow-up. I like operating from people all over Australia, and usually if the follow-up goes smoothly, we can communicate via email and Skype, Zoom now for follow-ups. The resolution's actually better on Zoom. And that seems to work well for a number of patients. But there are challenges when you're far away and you can't get easy access to your surgeon. I mean, now with more people fat grafting, or at least doing a little bit of it all over Australia, there are people, they can go and see that will have now some experience with fat grafting. But, we're happy to see and follow up patients at any time, but can be challenging, particularly if they live Perth. West Australian patients can kind of be the hardest, but with coordination, it can be done. Usually I do an initial Skype consult with an interstate patient, and then I ask them to come for a face-to-face. We usually try and coordinate that face-to-face before their surgery. I do not like to do a face-to-face just before the surgery, because there are certain things that cannot be assessed on Skype, particularly skin quality and how they're going to respond to liposuction for the fat grafting procedure, and tissue tightness, all those sorts of things, which allow me to give them a better indication of how their result is going to be. Can't perfectly be assessed on Skype. So once they're suitable, we do try and encourage them to come for a face-to-face. If it is close to the surgery date, I do have a policy that if they're not comfortable with me face-to-face, or if something is not as it has appeared on Skype, they don't proceed with surgery.